Mom was not one to spend much time sitting idle. As a young child, I remember the hours she spent working in her beautiful flower beds. I can picture her kneading dough and rolling it out as she baked homemade bread and cinnamon buns twice a week for our family of 8. I remember doing aerobics with her to Fleetwood Mac in our living room, and my sister teaching us the hustle in the 70s. She also loved to walk. Growing up on a farm, she had to walk long distances to get anywhere. We lived at the edge of the River Valley Ravine, and exploring it was a big part of our lives. Eventually, we moved to an acreage, and we'd walk the country roads listening to the crickets. When my parents first arrived at the Kipnis Center, my mom was still very mobile despite her Alzheimer's. One of our favorite activities was playing music in Dad's room and dancing. It was difficult to have a conversation with her at that point, but music was still a great way for us to connect. About 4 years ago, Mom fell and broke her arm. She needed to be in bed and a wheelchair for several weeks to allow her arm to heal, and by the time it was better, she wasn't able to walk anymore. I'd been watching helplessly for about a decade as her disease progressed, and to see her robbed of the pleasure of movement made me doubly angry at the injustice of it all and my inability to do anything about it. A few months ago, my sister told me about a new initiative that Pava, the care manager, had discussed with her. It was called the Power of Movement, and she was asking for support from family members. I knew that regular activity was important to both physical and mental health, and it was nice to finally be able to do something, anything, to help Mom. The next time I visited, there were diagrams showing a range of mobility exercises posted in Mom's room. The arm that she broke had limited mobility, and moving it caused her pain. I felt awful whenever I caused her pain, but slowly, I learned to watch for all the kinds of feedback she could give. Together, we started to experiment and learned her limits. Some of the exercises required her to be lying down, so I adjusted the timing of my visits to coincide with her afternoon nap. I learned to watch my own body mechanics when doing the exercises after my sister learned the hard way and ended up with several weeks of back pain. Over time, we've all figured things out. I faithfully adjust the bed height and engage my core when doing the lower body exercises. We use music and wheelchair dancing to have some fun with upper body exercises. I sing or make silly noises to make it more fun for my mom while we're doing the exercises. My sister thinks that Mom is moving her arms a little more freely since the Power of Movement program has started. I hope so. For me, I think doing exercises with Mom is a great way to connect with her and help her reconnect with something that was a source of pleasure throughout her life. It gives me great joy to be able to give her small amounts of happiness.
You're having a good time.